10 out of 10.
What's the angle? I'm not playing that game. It's the same business.
Hello, welcome to my channel. Here is my friend Patty. He is a pharmacy technician. We are doing a Q&A.
Let's start.
We're gonna start.
Yeah.
Okay, we can just jump right into it. Patty, would you like to introduce yourself?
Sure. Hi everyone, my name is Patty. I've been working as an inpatient pharmacy tech for 4 years.
Is it hard being a pharmacy technician?
I don't think it is hard. I believe it really matters that you know how to multitask.
What is your best advice for becoming a PharmTech?
Don't go to a private school. Also, when you're doing your externship, make sure you network.
How was your schooling process? How did it go? How many years did it take you to finish PharmTech school?
So it usually takes from 8 to 12 months. It took me longer just because I was working, so about 2 years.
As a PharmTech, do you use a lot of math?
We do, but it's minimal. I do it when it comes to double checking like concentrations, just to make sure, yeah, but it's minimal.
Would you consider a PharmTech as a career or a long-term career?
Yes, I will. For me, it was a way to get into healthcare, so I know most of the people find themselves going back to school or really liking working in healthcare, pharmacists or nursing.
What do you love about being a PharmTech?
I really like the flexibility I have. I also like having different shifts, different roles. I also like having different tasks during the day. I know comparing it to like retail, you're doing pretty much the same thing every day over and over, so yeah, I like that.
What do you dislike about being a PharmTech?
Where I work, I feel like there could be better communication sometimes. Also, some of the workflow and the shifts, I feel like it could be more evenly distributed.
What do normal shifts in your schedule look like for you?
I work like every shift they have. So like this week I have the 9 a.m. shift, 2 days, and then 7 a.m. and then I do 5 a.m. So the 9 a.m. pretty much checks are the cart fill, and then they do any compounding or pre-packs that are to be done. They also cover, we do med deliveries too. 7 a.m. you're sending doses or new orders or meds that the pharmacy might have to send that or something that the nurses might be out of stock and they need. The 5 a.m. gets ready all the cart fill, all the meds for the patients for a 24-hour supply. Also do med deliveries to the floors.
Thank you. Why did you choose to become a PharmTech and how did you get into it?
I wanted to try something in healthcare, so it just happened. I was on my computer one day and then I saw an ad for it, for a program. So I tried it out and I liked it. So.
Do you like what you do?
I do. I like I said, the flexibility. I like doing different things during the day. I'm not doing the same thing for the whole shift, so I like that.
What do you think has been a challenging part of your career so far?
Maybe multitasking, learning, what needs to be done first, and then make sure to focus on one thing at a time. So it is patient care, and we gotta double check that.
Do you feel like you're fairly compensated at your current job?
I do. We have good benefits, raises too. We get an incentive every year. So yes, I do.
This is from a viewer. Do you think as a new grad tech, it would be a good idea to go inpatient instead of retail setting? I worked at a small clinic as a clerk, and I've heard horror stories of people who worked at a retail pharmacies. but I wonder if going straight to inpatient is doable or a good move.
Yes, it is doable, and I feel like it would be so much better. For me, retail didn't work out. I tried it as a clerk as well, and then of course during my externship. It is doable, and I recommend it to go for a hospital setting better.
Right. Well, thank you very much for your time, Patty.
Thank you for having me. Bye guys. Thank you guys for watching.
See ya.